Hi, this is Marty with Skincare Science and welcome to another video. In this video, I'm going to go over some advanced techniques with regards to trichloroacetic acid and ice pick scars and needling. So this is about taking things to another level and allowing me to show you some actual pictures of clients, and I'll try to hide their identities as best I can. Of course, the person looks at it, they're going to know it's them, but I'll do my best to zoom in on it and show you how I treat acne scars and how I use some advanced techniques and some unique ideas to really take things to another level. And let's get started. First of all, what I'm going to do is I'm going to go ahead and show you a picture. So we're going to zoom in on an acne scar.
So as you can see, right in the center of the circle is an acne scar that's very similar to the one that I'll be describing in this video. What I'd like to do is I'd like to look north, south, east, and west, and I would like to talk about what's going on with this individual's skin. So just south of the circle, do you see that pigmentation? That right there is something that shouldn't be there. Do you see how it's not specifically in one spot, how it's deeper and it's mottled? When you view the skin like this or with a 16 times power, you see things that you wouldn't normally see. Remember, we're dealing with microns. Can you also see the hairs that are coming out of the pores? And also to the to the left, that's west. Do you see those? And then if you really look closely, there's an acne blemish. If you look at the scab, you need to find out how that scab got there, because that to me looks like a 10 times mirror assault with an OCD behavior. This individual is not going to be good for high, if your state allows trichloroacetic acid or Jesner, this person's not good. That is an indication of picking. That is an indication of lack of control. And that lack of control is going to cause serious problems as it relates to the procedures that you're going to be doing. Now, if you're going to perform needling or higher strength acids such as TCA or Jesner. So the next picture that I'm going to show you is of the same client, and it's her forehead. And what we want to concentrate on is the same pattern of modeling. See the darker colors that are underneath the circle to the south? That area there, we want to pay attention and look on the forehead. So we'll go to that picture now. Before we go to the next picture, and the issue is going to be the monitor. If your monitor is not clear enough, you won't be able to see the modeling that I'm talking about. But I zoomed in just south of the circle with the acne scar in it, and I want you to notice and remember what this looks like as we go to the forehead. I think it's really important. Looking at her forehead from this distance, it obviously we'd like it to be clearer, but if we take a look at some very specific areas, we're going to see the same patterns. Now, you're thinking, well, Marty, of course, we're going to see the same patterns. It's the same person's face. Well, yes, that's true, but what's creating them? Are those all acne scars? Are we 100% sure that they are? Are they being created by something else that's going on? Are those dark spots on her forehead a result of her picking? You see, without accurate records, without taking notes and actually with pictures identifying these hyperpigmentations, and it looks to me like above her eyebrow, I see hypopigmentation. So be careful and take a look at not only the darker and the imperfections that obviously is bothering this client, but also from a professional view, the opposite, which would be hypopigmentation. So let's go ahead and take another shot and look at zoomed in. So looking at this picture, do you see what I see? To the left, I see lighter skin patches that don't match the base. If you look at the corners or the bottom right-hand corner, you get a sense of the base skin color. And then you look up from the bottom right-hand corner up, what created those star-like pattern of hyperpigmentation? And is that hypopigmentation underneath it or just a lighter pink? You see, with the use of the 16 times loop, you'll be able to see that. And then if you look directly at the darkest spot, right in the middle of the screen, go up a little bit, and then to the left, you see that collection next to a spot that is, well, what looks like it's hypopigmented, but that could very well be just the nature of the color of the foundation of the skin. One thing that's critical to look at is the hairs that are coming out of the pores and the strength, or I should say the coarseness of them. Sure, I'm zoomed in, but they're very identifiable. That is very important as it relates to salicylic acid and utilizing that type of treatment. And that's the way I see it, because glycolic isn't going to be able to get down in those hair follicles. And that is creating, for me, a major concern with regards to attempting to guess and understand this person's genetic makeup and how to help them. If you sit back, because right now you might be very, very close trying to look. I want you to sit back and I want you to stare at the right-hand screen in that collection to the right. And then I want you to pan to the left quickly. See if you think you see a very large patch. If you're to divide this picture into thirds, do you see the large patch of hypopigmentation? Now, it's a judgment call. It does not necessarily mean it's there, but as you zoom in and zoom out, you see when you look at a picture like this, it's very different than when you look at the face as a whole. And that's why I want you to look at it with more than just a 10 times mirror and actually really get up into the face and actually get as close as you can. I hope this different view and this different approach helps you and triggers questions and questions your experience and what you've been doing, and maybe this will help you do something in a different direction where a light bulb will go off and you can really make a difference. Maybe it's changing the way you do this or that, or adding this or taking this away. The important thing is, am I giving you something to think about? That's the most important thing. Am I giving you a different view that you can take and become a more successful esthetician and reach your client's skincare goals and maybe your own? But that's the goal here. I hope I've accomplished it. And let's get back to the main video.
All right, so looking at the first picture, we see, and I need to draw this a little bit, I'm guesstimating, but I need to do it this way. So what we're going to do is we're going to take an acne scar or ice pick scar, and I'm going to draw right here basically what's going on. In a later tutorial or video, I'll dive in deep and talk about some just more in depth. Okay, so let's look at it. Let's look at it this way and straight on, and we'll see what the skin's doing. So if this is the square of the patch of skin, okay, we're going to be noticing something that looks like that. So that's the acne scar. And if we look at a picture, so I'll go ahead and put the picture up. So you look at that. So as you can see, it's similar to that. And even if it was, off or whatever, it's okay. So right next to it, I'm going to draw the cross section. When acne scars the skin, it basically leaves an indentation like this, and then we've got the SC, and then this is, it just keeps going down, and this is very crude. It's not this is what I want you to pay attention to. At a later time, I'll deal with this. Okay. It doesn't, it's not correct. This is the sorry. This is the epidermis. This is the SC, and that's the dermis. Okay. So basically, when you have cystic acne or scarring acne, and again, this is very crude. It doesn't look like this at all. The cyst actually disrupts the dermis at the site, and it basically collapses on itself. So we'll go ahead and take a look at that, as I said, later on. But what we want to do is we want to look at this right here. So this is the area of concern right there. Okay. All right. We've all seen an acne scar. So what I've done is I've drawn, looking at it from top down. That's what it looks like. Okay. And this is a cross section. This is very crude, but what I want you to pay attention to is what's between the arrows, this area here. Okay. Now what I'm going to do is I'm going to basically tell you a little bit about trichloroacetic acid. All right, and the hard part is, depending on your state, you may not be able to use trichloroacetic acid. You may not be able to get it and use it legally on your license. So that's why I include dermaneedling, because there is a similarity between the two. So let's keep that in mind. But I use both or instruct on both. All right, what I'm going to draw here is another, but I need to use two different markers. So I'm going to draw that again, and I'm going to draw it right here. Try to, get that. Okay. So there's the outline of the scar. Okay. So what I want you to pay attention to is the outline. Okay. When you look at the skin, when you look at the scar, you may look at a magnifying glass, but notice that on someone's face, right? We'll do this. They've got one. They've got one here on their chin. They've got one there, and they have one there on their and there. That's about right, correct? Okay. If it's more than that, this isn't going to really work. It's a one-off thing. It takes a little bit of experience. So it's best, if you're going to attempt to work with this technique, you need to get the right client and practice. Okay, less is more. One scar, maybe two, but if it gets too many, it becomes a lot to deal with. Okay, all right. There are two tools that I need you to get. Okay, so all right. This is the same eyepiece that you would look at stones with, diamonds, or if you're a collector of coins, numismatic. This is a 16 times magnifying glass, and when you look through this, and I'm going to show you how, but what I do is I take this and I look with this at the acne scar, not the mirror. What I want to do is I want to look through this, and you're going to hold this directly up to your eye, very, very close, right at the skin, and you're going to look at the acne scars with this. I definitely recommend that you get a 30 times one and the 16 times one, so that you can get an idea of different visuals. Remember, we're dealing with the skin, we're dealing with microns, and when I show you the videos, I'm going to try to mask out her face, but I'm going to show you her face as a whole, and then I'm going to zoom in on it, and I'm going to show you the difference of looking up close versus looking at the full view. The second item that you're going to need to get is it's by Faber and Castell. You can go to any art store, any like a Michaels or a high-end art store, and this is a Pitt Artist pen. Okay, it is 0.1. Okay, so you have 0.1 of a millimeter is what this is. Okay, so these two tools are what you're going to use to apply trichloroacetic acid and needling. And I'm going to explain both and show you how I do this. I use these two tools and this technique to increase collagen and reduce the visibility of the acne ice pick scars. And I'm going to show you how I do it and give you all the details, and hopefully it'll make sense to you and you'll be able to perform it and or practice and or look into it and decide if it's something that you want to bring to your profession. So what I'm doing when I look through the eyepiece is I have the pen right there under the eyepiece and I dot like that. Okay, that's my border. Now, I want to make sure that I use very little ink, just enough so that I can see it. That's all I want to do. And then the next step is, once you have outlined the scar, what you're going to do is look at the entire face. And this takes some time because not all of them are worth doing. And you need to be able to practice and look at enough of them to know whether or not a very superficial chemical peel, or maybe a very light dermabrasion, or maybe a very light dermaplaning that will equal the depth of a moderate chemical peel can take care of some of the scars. You see, one of the great things that is a patented fact about the use of chemical acids is that they will induce collagen production. Dermaplaning and microdermabrasion, because of their exfoliating nature, they also get classified as a dermal thickener or a collagen booster. Okay, now you know how I play on this, so we're all in it for the same goal. We just have different paths or roads to travel to get there. All on the same page. All right. Once you come to this point, and again, you're looking through the eyepiece. Okay, I mean it's that close. Okay. What I do is I have a dropper, and I have this in trichloroacetic acid. Now, I have a benefit that you don't. It depends on your state again, but this is a proven medical procedure, and the use of high concentration of trichloroacetic acid is what is used. But if you use 5 or 10%, it will get you through the day. It is an option. Okay? When you use more, it's not such a good thing. And what I mean by that is a higher percentage. Okay, I sell in the Serene line, it's 5%, 10%, and it's 1%, I'm sorry, 1.0 pH. So ultra low pH, it's coat dependent, it's a protein coagulator. The more coats, the deeper it penetrates, the more skin cells that it cooks as a protein coagulator. I'll go over TCA in another episode or another video, but the idea here is to understand the use of trichloroacetic acid as a chemical acid. Its sole purpose is to peel only what's inside of here. This is what we're after. You see, because if right here, if I draw the dip, see that? Well, if I put trichloroacetic acid, or you do microdermabrasion, how are you going to touch just this? You see what I'm saying? You have to go into the ice pick scar. You have to go into the scar to get it. Okay? And the same thing with needling, and that's the second step. All right. Needling has different methods to it. Okay, it has different needles. So if we're going to do this, here's 1 needle, 2 needle, 3 needle, 4 and 5. Okay, and then I'm going to go ahead and take this, and then I'm going to go ahead and demonstrate the actual depth. Okay, so there's your here's your SC. Okay, right there, and then here's your epidermis. Okay, and then you have the dermis here. Okay. When I discuss needling, there are many different lengths of needles, and there are a lot of different apparatuses or handheld instruments that are manufactured around the world that make this procedure easier and more reliable to perform. With regards to this procedure, what you want is you want to use the same needle length. And to make it penetrate deeper, you want to use your pressure, your own force. This is a 2-step process. The first thing is when you identify, it's actually a 3. This is a 3-step process. Identify the acne scars that you cannot treat with a topical procedure, meaning chemical peels, or if you so choose, dermaplaning or microdermabrasion. And again, that's very, very, very light. And it's not to eradicate the epidermal layer. It's basically very superficial. You know that I prefer the chemical peel route. We all have our path. The second step is to identify the acne scars that you can actually perform this procedure on. Now, how you identify them is by making these dots around it. When you're done, her face will look something like that, or his face. The second and third steps are, so I'm going to write 1, and I'm going to say identify. There we go. 2, outline with the dots, and then 3, perform. When you get to this point here, this is critical. If you don't do this, you might as well not even be watching this video. You just don't make this mistake. Picture. Cannot stress it enough. You must have a picture as to where on the face they were, because with this procedure and with these techniques, they're going to diminish and you can't be confused. So you really zoom in there. The more pictures, the better. So the first thing we're doing is we're identifying the acne scars that are large enough that we can treat because of the head or the tool that you're using for the needling. Okay. 2 is to outline them, and the less dots, the better. But if you get into an intricate acne scar, you want to go ahead and use the dots. That's why I use a 0.1 millimeter. It's very, very small. And that's why when you take the picture, you have to zoom in. Okay. 3, perform. You're not going to do trichloroacetic acid and needling at the same time. You're just not. If you wanted to use glycolic acid and do that, you could try to attempt that. Use a low percentage, higher pH. Like for example, a great product to do this and to try this with, I use TCA, so I haven't done this, okay, would be 35% glycolic acid at 2.5. And the reason I'm choosing 35 is because the options are 10, 20% glycolic acid at 2.0, right? Or 50% at 1.0. I'll do a complete education on acids and pH, but 35% glycolic acid with 2.5 is perfect. High enough strength, low enough pH, and it's time dependent, right? We're not going to do combination. For me, I do the acid first, and then I do the needling, okay? When you perform the acid first, either a dropper or a toothpick, and you need the eye loop, and what you need to do is you need to drop it directly into the center, and you need to practice. Nothing is going to happen bad. There's really no real risk here with really much of anything unless you act not very smart. The liquid might roll over. See, you're going to drop it here, right? And you might fill, okay? And it might go over. If it does, it's okay. It's going to look like that. It's okay. Because the healing and the way that the skin performs, it'll visibly be a lot smoother, and you don't have to worry about, it doesn't have to be, like this. And you fill it right there. That's not what this is, okay? So don't worry about that, all right? And use less acid. You can always put more on. With TCA, it's coat dependent. So you put it on, you watch it, wait 10 minutes, see what it does. No frosting, put another one, put another one, and put another one, okay? Eventually, it's gonna frost. TCA education, protein coagulation, another video entirely, okay? Glycolic acid, no problem, time dependent, 35 2.5, 2 to 4 minutes, okay? All right, now to the needling part. You're going to come back, identify, outline, and perform needling inside there. Now, here's the key. Needling has the head of the instrument and a lot of different depths, right? But for this technique, I don't want the machine to do the depth. I want you to feel the depth like a tattoo artist. Okay, so if you have experience with semi-permanent brows or eyeliner tattooing, and you also do this, this is going to be a cakewalk for you. So this takes talent, this takes practice, but you want to be able to use the smallest amount of needles and pressure, and just like that, right in the center. And let me go ahead and draw this so I can show you what this kind of looks like when you're done. Okay, so then we've got our outline here. Okay, like that. Okay, what I want you to do is, it's okay, remember, it's okay if the needle does that. Just remember to do this. The handheld instruments put, like, it's so much like laser, it makes me laugh. Okay, so with needling, you have the face and you go here, 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 or you go here, 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 like that, right? Real close together, and then you go all over the face just like you would with a laser. All right, well, here what you want to do is, you want to go ahead and do more. Here, and then feather out. Okay, so to show what it would look like, and this is an exaggeration on the feathering, but to show you, like that. All right, now what am I doing? Well, if you understand how the skin functions, how the skin heals, this is what I'm doing. This is really cool. All right. If I injure this, and this is based on laser. Okay, this is like, what's the skin gonna do? It is going to pull from here. cells that are healthy, that you haven't injured, are going to migrate in. The more you injure the center, the more it will pull in. That's just how the skin heals. It needs healthy to regenerate. Okay? Injury, fresh, new skin cells, healing. What's going to happen here? Increase in collagen. And it's going to rise. It was like that. Now it's like that. And it's going to push this right there. Again, the illustrations are very crude. Maybe I should be a better artist. Maybe I should be. Okay, but this is the idea. Okay. Now this goes into a regeneration cycle. Okay. I'm going to go ahead and erase all of this, and I'm going to go and I'm going to draw a regeneration cycle calendar on how the time frames. I'm going to go ahead and stop here, erase this, and then draw a regeneration cycle for you that includes acid, ice pick acne scar, and needling to reduce the appearance of acne scars, increase collagen. The regenerating cycle will identify for you the time frames and what you should be doing in between and what you shouldn't be doing. I will already have it drawn on the board when we come back, and let's get into that next. Welcome back. As you can see, I have quite a bit. I didn't use different markers. I should have, shouldn't I? I know. But I like the pink, it looks good. Okay, so I've got quite a bit written on the board. Let me go over what this is. Ice Pick Acne Scar Regeneration Cycle 12 month. This is a 6-month regeneration cycle. January, February, March, April, May, and June. 1, 2, and 3. 1 treatment, 2 treatment, 3 treatment. You have to decide whether you're going to do 1 needling or 1 acid. When you decide what your first one's going to be, you alternate it. I always start with acid. February and May, in the middle of each quarter or 3-month period, you're going to do a full face chemical peel. Why aren't you going to do microdermabrasion or dermaplaning? If you watched the last video, you now should have a little bit of a foundation, the different layers of the skin and what skincare issue it creates. Fine lines and wrinkles, hypopigmentation. We don't want to induce mechanical exfoliation. We want the skin to be able to fight back. The acid that you are going to use, depending on what Fitzpatrick scale it is, and here's the key. This fits all Fitzpatrick on the small scale. What I would like you to remember is this. Fitz 1, 2, 3. Small scale, watch what I do. The star is under the 2. That's the one that you can take the most chances with. As you venture to the 1 and as you venture to the 3, take more precaution. That's what that represents. I can go at it without doing that because I don't need this because it's so ingrained in the way that I think. I don't need to pay attention to that because It's so ingrained in the way that I think that I carry it with me through everything that I do. It's almost like my starting point. Remember I said in one of my videos earlier, I don't pay attention to T-zone and all that. That is where it's at. And obviously, based on what I'm telling you here, T-zone isn't my concern. This is always in my mind. So I don't pay attention to other things so much, or I'm nervous about so much, because being sensitive one way on the small scale from 2 to 1 and 2 to 3 is at the foundation of every step I take with regards to aesthetics. So, and it is involved in here as well, as you'll see. All right. So to recap, 6 months squared is a 12-month period of time. 1 quarter, 2 quarter, 1 procedure, 2nd procedure, 3rd procedure, 3 procedures in a 6-month period of time, followed by 2 chemical peels in between. Full face. Okay. Here is what I would like you to do. And there's room. Okay, this is not the gospel again, but 35%, 2.5 pH, three to 4 minutes. I can go higher, lower on the minutes, lower, higher on the minutes, or I can do this at home if you don't want to do the chemical peels, and that's what I'm going to discuss right below. Or you can perform this. What I'm saying is, if I give you AHA 15, AHA 12, you will be able to tell the client you are going to use dry hands, dry face, and you are going to set your phone timer, and you are going to take AHA 12 or AHA 15, and you are going to put it on your face. Here's the key. The client is not going to be able to stop the timed depth penetration of the glycolic acid. And the reason why is they aren't trained and they aren't practiced. So what you're going to do is you're going to tell them before they go in the shower. You're going to have them set the timer. Normally there's somewhere where the phone, or it can be, I don't know, the top of the toilet, or there's a sink, there's a counter where the phone can go. Set the timer for the prescribed minute. Client puts it on their face in front of the mirror, immediately gets in the shower and stands there. The water does not hit their face. The second they hear the timer go off, they go into the shower and they remove it and they inundate their face with water. Now here's the key. You don't want them taking jets. That's obviously. You want them to be able to dilute the acid instead of neutralizing it, and dilute it enough so that there's no more feeling whatsoever. In the shower is the best way to do that because of the sheer amount of water. Okay? If you're trained in how to perform chemical peels, this will make perfect sense. Now, within the serine line, there's various percentages or units of glycolic acid, correct? 8 to 15. AHA 8 astringent, AHA 12 facial cleanser, AHA 15 refining gel. What is the primary? First one to go to. That would be the AHA 15. Then the AHA 12, depending on the experience level and your experience level. The last one is AHA 8 astringent, and the reason why is because not only is it just the 8, but it's in a liquid form. So it's not a gel. Gels have a tendency to induce a greater depth of penetration because they're a gel. Now, I've never seen exactly why that's the case, but we can pretty much see the gel would sit on top of the skin, and the way that the material is, it's going to sit there, the skin's going to absorb it, it's thicker, it's going to slow down the reservoir function of the skin, which I'll talk about in a later video, has a difficult time dispersing it. So those thicker gels are that include acid, have the tendency to be a little bit stronger than a normal liquid. That makes sense. Okay, so that's definitely covering all of that. Now I have 2 to 3 minutes here on the time, but again, it's your client, you know them, you can, being in the shower like that, you can go more, and not so hot, keep it on the lukewarm side, let them know what they're doing. So go in a little bit lukewarm, or cool, and then go ahead and turn up and do your regular shower, okay? So instruct them with your own knowledge base as it relates to warm, hot water with regards to the procedure that we're doing. Okay, and that handles the month in between. Okay, so we've got January. Let's say for me, this is what I would do. January, I'm using trichloroacetic acid, and I'm treating ice pick acne scars. Okay, then in February, I'm doing a full face. Okay, now that could be 6 weeks, right? You see how that goes? I've got swing time in there. The first of the month in January, I've got that full month. When in February do I do it? There's my swing time. Okay, then, but I have to know, you have to plan this. So then I know March is coming up. Okay, all right. So we've got March for the needling. Okay, I've got my pictures. So I know exactly what I'm treating, exactly what I'm looking at. I've got 2 different lights. I've got the round light, 10 times mirror, and then I've also got the eye loop at 16 times and the eye loop at 30 if you really want to go the extra length. Okay, and I repeat that for the second 3 months. Now, AM and PM protocol for the first to the 6th month. Facial cleanser, sensitive skin. Okay. Facial toner. Now, there's a product I've never talked about. We'll talk about that later. But natural moisturizing factor, vitamin C, facial toner, hyaluronic acid serum. What do you notice about this AM protocol? No lotions, no creams. I don't want the cream. I don't want that in my AM protocol. That's just me. The client could be different. You could feel different. Remember, this isn't kidicize. This isn't, we're not robots here, okay? Could I have chose ceramide lotion to put here? Absolutely. But I chose hyaluronic acid and facial toner. We're dealing with oily acne clients, okay? I'm choosing ceramide lotion in the PM. Facial cleanser, sensitive skin, ageless peptide cream, ceramide lotion, healing mask, vitamin A, and vitamin C. Now check this PM protocol out. It's pretty nifty. Okay, why the ageless peptide cream? Topical peptides have been proven to induce collagen production because our own natural peptides is what signal our body to induce collagen production. I'll go over that active ingredient at a later time. Secondary, ceramide lotion. Ceramide 2 is in the stratum corneum. And where and what are we doing? We are assaulting the stratum corneum, the epidermal layer. Are we not? The acid? So I want the ceramides to help build up that intercellular space. Healing facial mask, vitamin A and vitamin C. Okay. Vitamin A and vitamin C are anti-aging products that go back, what, 20, 30 years? They're tried and true, right? They work. Some vitamin A's are actual prescriptions. We all know that. Vitamin A and vitamin C, alternating nights. On the night that you do vitamin C, this is the protocol. Facial cleanser, sensitive skin, and wait for it, 50-50 mix of ageless peptide cream and ceramide lotion. Ceramide lotion, ageless peptide cream, put them together. Then vitamin A, one and done. Now, for me, I want the ageless peptide cream and the ceramide lotion done. I want that every single night. So the vitamin A alternating, say vitamin A is Monday, Wednesday, and Friday, whatever. Vitamin C is Tuesday, Thursday, and Saturday or Sunday, okay? If you wanted to, you could actually do the vitamin A, the ceramide lotion, and the peptide in this mix. And I think I would actually recommend it because, and wait for it, this is really cool. The product you're basically building is anti-age regenerating cream. These have the active ingredients at higher percentages, anti-age and regenerating cream, together, lower percentages. See how that works? Okay. So like, for example, let me make the point on product knowledge. If someone's on a budget, give them anti-age and regenerating cream. If someone's doing this, they have no choice because we need the highest strengths to get the job done. Okay. All right. Facial cleanser, sensitive skin, Ageless Peptide Cream, Ceramide Lotion, 50-50, or Ageless Peptide Cream, Ceramide Lotion, Vitamin A, 30-30-30, together. Alternating night, Vitamin C first, Ageless Peptide, Ceramide Lotion, alternating night with Vitamin C, 2 to 3 times a week. Vitamin C first, Ceramide Lotion. You can add the peptide and do the 50-50, and then you're going to occlude it with Healing Facial Mask. That's the protocol. That's the treatment regenerating cycle. What do you think? It's pretty good, isn't it? That is mine. Remember I told you in the original video, in the first videos, if it's mine, I'm going to own it. This is mine. There is no one in the skincare industry, that is educating on this, that is teaching this in any way, shape, or form. I look forward to questions and comments. Keep that debate going, keep that information flowing. Tell me what you think would be even better. Love that. Give me an idea. Let's improve it. Make it even better. It's not all about me. Thank you very much for watching, and we'll see you in the next video.
Okay, this video is still in private mode, so I wanted to go over this client. I didn't want to put it up, so this is basically a one-off thing. Okay, if this client keeps coming back for dermaplaning, I would stop. I would do facials with her, and I would find out what her goals are, and I would have her stop tanning, and I would get her skin back to a non-tan state. The tanning is making the skin go in the opposite direction. There might be a potential that this client, okay, first of all, if you look at this picture, what do you want to do to the skin when you look at this picture? If you want to take a piece of sandpaper or a wire brush or microdermabrasion and you want to scrub her skin to the bone so that it can regenerate, that would be the feeling that would be equal to mine. That's what I see. Dermaplaning cannot help this client. This client cannot be helped with superficial microdermabrasion. I believe that a very high strength fennel peel and no one ever does fennel anymore. It's just not practiced, and you have to have some serious guts to do it. But this client is a laser client. If you look very closely at her skin, it's been damaged heavily, and we're talking about, all the way to the subcutaneous layer. So there's really not too much you can do as it relates to topical. I want you to know that if she came to me one-off, it would be difficult for me to treat her. Now, you've been treating her for a while, so I would look to more of the fluffy type type treatments instead of the invasive, because let's face it, if you're not going to the dermis, you're not doing her any benefit as far as restructuring, resurfacing her skin. I think your major job is to get her in a healthy position with her skin. And I believe she's tanning or goes in the sun quite a bit, and it's making things worse. Is this one of those clients where the damage is so bad that it's like you just throw your hands up in the air, you don't do anything, and she's a good client and you just take care of her? That's awesome. What does she say? What are her skincare goals? If you look at the picture on her left cheek near her nose, there's some serious stuff going on there. If you look at this picture and you look at the the blood vessel, or that's definitely something that you would not want to be planing the skin or doing microdermabrasion on. It's just a contraindication. So what I did just by using this little clip of her forehead is just so that you can see the texture of the typography of her skin. That just cannot, honestly, it's above aesthetics. Unless you're a laser technician, or let me say it a different way. I would not treat her with trichloroacetic acid or Jesner. And the reason why is because I think she's tanning and she's not taking care of her skin. So I can show you pictures that I've done to somebody, and maybe I'll put that picture in here and you can see that as it relates to the type of treatments that I've done. And maybe let me go ahead and do that, and then you can see just how deep I've peeled. This is on a whole nother level, a whole nother layer, right? So let me go ahead and stop this audio. Let me go ahead and get the picture up, and then I'll continue on in a second. The next pictures are going to be of an individual that I treated, and this individual basically just had massive hyperpigmentation. This individual spent a lot of time in Orange County for a few years and really didn't pay attention to sunscreen, and basically was covering most of this up with makeup. So let's go ahead and take a look at the before, and then I'll show you the after. So take your time, flip through these and take a look at them, and then then we'll have the after just right after this. The treatment that was performed on this individual, this is the befores, when you look at the afters, it'll give you a better representation, was a trichloroacetic acid peel, 25%, 1.0 pH, applied with a fan brush, and there was visible frosting over the forehead and mainly around the under eye areas. The end result was obviously fantastic, but the downtime was horrendous. I will continue to look for the pictures. I don't know where they are. I think they're on backup, but I will find those for you and upload them. Yeah, the pictures would be nice so that you could see the damage that was done, but unfortunately, so sorry about that. Yeah, I'm sorry, I can't find it. It's on a backup or something. So I'm going to go ahead and upload this as is, and when I find the video in my travels, I'll go ahead and re-upload it. So this video is not live. It's private, as I said, so there's a lot more to come, a little bit. Sorry it's so long, but yeah. All right. Have a great day. Oh, and yeah, keep watching. I hope you're enjoying it. So aside from a different color variation, you can obviously see that in the picture. Was not my fault. Obviously, I wasn't there to administer these before and after pictures. But as you can see, there was a definite improvement. The issue is that if you take this person's skin, which is the typography is coarse and rough, much like the client that we're looking at with regards to the forehead, but the sun damage is very evident. So to continue to do topical exfoliation on this client would is really a waste of time because of the sun damage. There are other contraindications on her skin if you look at it, very, very, very closely. And as it relates to continued exfoliation, it's just not something I would do. What I'd like to do is I'm trying to find pictures of this individual that had a lot going on with regards to the healing process. So I'm trying to find that, and when I do, I'll go ahead and post it in a second, and you'll be very entertained by that, to say the least. The reason I want to show you that is because I want to show you what it takes sometimes to get to the layers or level that you want to, as it relates to really trying to resurface or remove fine lines and wrinkles and cases of hyperpigmentation. So let's try to find that last picture, and we'll go from there. Oh, and by the way, as it relates to my opinion, now the ball's in your court, Tiffany. You need to tell me what you think of this video. You think of the skin, the before and after pictures of this individual, and then how you think you should treat and what you think about what I've said. That's the most important thing, and collectively find out what's best for your client. While I look for that picture, be entertained by these. These are actual pictures that I took of what the whiteboard as I was educating, for new professionals and 5 and 10-year professionals. All of this information I will do videos on. The reason why there is so much going on is because that's the interaction with the students. They're asking me questions and I'm elaborating. So when they get really full and really crazy looking, I'm trying to explain something so that they'll grasp the concept. Every single thing you see will have a video attached to it. When you see a lot of my educational videos and listen to them, and there's a pauses or there's other sounds related to it seems like I don't know where to go, but the reality is I don't know what information to give you first. So I hope you enjoy these. Some of them, I have to say, I look at them and go, if that's what my brain looks like, there's a problem. Enjoy, and I'll get that picture for you. So in this video, I will state it, but I don't as of yet, but I will. The instrument that is used is a HDI brow, 7-pin cluster, and a 5-pin cluster. That is what was used for the scarring. So take a look at a number 7 and a number 5 cluster, and it's very much like tattooing. So I really hope you enjoyed all of this. And again, as you can see, there's so much. This is almost, an hour? And I know there's a lot of information that I didn't even cover with regards to, preliminary steps and pre-treatment and all that. I'll get to it, but one thing at a time. Have a good day.